Oh, the NHS. I mean, it's struggling so much. It's struggling so much. It's breaking my heart. My poor mum, she's got a really bad knee. She's hobbling around like, you know, really old age pensioner, and she's always been very sprightly. And it's so frustrating because they keep phoning her up, cancelling this appointment because of sickness. Oh, you got to go for an X-ray, but you're going to have to wait a month. Oh, you got to wait 3 weeks for your results, and nothing. Nothing. The woman's in agony. And it's making me so angry because she actually worked for the NHS for decades. And you just think we've got to get a grip in this country. It's not okay to have a health service on its knees. Doctors know this. They know how long waiting lists are. They moan about resources. They moan about not having enough time to see patients. So why, for crying out loud, are junior doctors, not all of them, but some of them, going on strike yet again, when they've already had a pay rise equivalent to 28.9% over the past 2 years? Oh, wouldn't it be great to shower them in pound coins and £50 notes? Yeah, great. We can't afford to. We know how bad the economy is, unless you're living under a rock. Turns out the BMA, however, when it came to polling people on whether or not they wanted to go on this strike, 48% said no, 19% were unsure, so only a third of them backed it. And it's just going to hit the NHS really where it hurts again. And I don't blame Wes Streeting for accusing the BMA of trying to hold the country to ransom and calling it morally reprehensible. Let's speak now to Dr Bhasha Mukherjee, who is an NHS GP. Dr Bhasha, I mean, where are you on this? Do you think we're fair enough? You know, for a long time we have not paid doctors a wage that represents their skills and how important they are to society? Or do you think, come on, this is not the time to be doing this?
So it's an interesting question about where I am on this, because I think nobody feels that these strikes are a good thing. Not even the doctors. I know it seems that it's a really fun option to go on strike, but it's not. I have to say that this is such a drain on resident doctors' morale that we are here for the 13th time in almost 3 years now. And it just feels like it's a revolving door where the government is not listening to us. And it's absolutely key that we understand that the NHS feels like a punishment to work at. It feels like a punishment to have chosen to be a doctor and to work in this country and to want to serve people. Because not only are you not being able to deliver good quality of care, you're having to pull through and hold it together when the whole system is broken. Effectively, one doctor would be doing the work of 2-3 doctors. And if you just imagine what that feels like in terms of constantly running on steam, essentially, not being able to deliver the care, and you know, at the end of it all, you still have the same outcomes in terms of poor outcomes for patients. So it's not a nice place to work at, and we're just trying to scream at the government to say, you need to do something about this. This can't keep going. This is all this is about.
But I mean, the doing something is not necessarily giving people who've already had a 28% pay rise over the past 2 years even more money. I mean,
what does that actually look like, though? That looks like going from £18 an hour to £23 an hour. It sounds like a huge amount when you're talking about in percentages, but if you actually talk about the hourly rate, it isn't such a huge ask at all, especially where this government,
if you add it all up, but you know, if you add it all up, the millions and millions and millions of pounds that it will cost to do that, if it doesn't really make much material difference to the doctors, that money could be better invested elsewhere, surely. And the thing is, you know, look, I have sympathy. I would love doctors and nurses in this country to be adequately resourced, to be recompensed in line with the skills and the effort and their necessity to public life. But when you train to be a doctor, you know what the pay brackets are, OK? It's publicly available information. You know what you are going to be paid, and you make the choice to go into that profession. And I understand that when you're in it, all of a sudden you come into contact with reality.
So are you suggesting to all those young people who want to do well in society, who want to give back to society, who want to help people, that they completely absolve all their aspirations to do that because they know what a, what a trap the NHS is to be working in? And therefore, they shouldn't even bother going into medicine at all, which is actually what is happening. And for those of the ones that are going into medical school and getting out of medical school, they feel so hopeless that they have to leave the country. They have to uproot and leave the country because they don't even have job security.
But I've also read that there are plenty of people who've gone through medical school and applying for positions within the NHS, and there's so much competition, they are essentially jobless and they can't seem to find employment. We also know they put a cap on the amount of training that people who can go into training at medical school, which beggars belief, quite frankly. But look, I did just say I have sympathy. I would like doctors and nurses to feel like they're getting the recompense that they deserve, but we know that we can't afford this. You'd have to be living under a rock to think that it's sort of, you know, milk and honey right now in the economy. We know that there are massive waiting lists and backlogs, partly because of COVID. And in what world is demanding more pay at this moment in time going to help? And look, let's be honest, right? I know that junior doctors or residential doctors, whatever they're called right now, don't get paid riches and they do long hours and it's probably very tough. But by and large, as a doctor, as you progress through your career, you have good take-home pay.
They're getting stuck. They're getting stuck in training at the very base level of pay because there aren't enough training positions. We, as doctors, are getting replaced, and this has been a strategic movement by this government and the government before us to replace us. And
with
this has been happening for years now by IMGs, so doctors that we import from other countries that we can afford to pay less, so they can drive down the pay for doctors in this country, trained in this country, by doctors not even doctors sometimes, PAs, pharmacists, nurses. I'm not saying that they don't have a role, but the roles are being merged and it's becoming very grey as to what a doctor does versus what a nurse and a pharmacist can just do a simple little course to just get the qualification to be able to prescribe, to diagnose. Whereas the amount of aptitude it takes to get into medical school, the skill level it involves to get through medical school, to go through the whole training program, that is completely being disregarded here. So doctors are feeling disillusioned. They don't have a position in society anymore. They're getting stuck at training level because they can't progress. So of course, it's, you know, can you imagine being stuck at the same pay, even if you're trying to increase your skill level, etc., and nothing's happening and the government's just not listening to you?
But you know what, what you're saying, I have a great amount of sympathy with, actually, because I think most people in most walks of life, if you were saying, do you know what it feels like to be stuck at the same rate of pay, however hard you try, however much you're breaking your back to go to work? I think there are people in all walks of life, from bin collectors to journalists, who all sympathise with that, because the economy is going to hell in a handcart.
Let's be very honest here. With the level of aptitude, and I'm going to be very blatant here, with the level of aptitude or skill set that a UK-trained doctor has, they can take that anywhere in the world and serve humanity anywhere else in the world, because humans are the same. UK population are not special in any way, and if the government continues to treat us in the way that they are, we have no option but to leave the country or go to private.
But then it's fine then, isn't it? Because what you're saying is, if that's the case, that's great, we can just import cheaper doctors and nurses from elsewhere. So which one is it?
And it still costs the NHS and it still costs the taxpayer to be working in this system where we lose our trained doctors and bring in new doctors from other countries who can't assimilate in the same way, who do not understand the same nuances of the cultural nuances that we have.
So what is the solution?
Any patient, who would they rather get seen by in terms of the camaraderie, the rapport building, etc., of UK trained doctors versus bringing doctors from elsewhere? It costs the NHS money every time we lose doctors to other countries.
I totally agree, and I think most people listening to this would wholeheartedly agree that I would love, when I go to see my doctor, to be seen by a British trained doctor, because you know those cultural nuances, the sort of particularities of language, you know that stuff's baked in, which when it comes to face-to-face treatment and care. And I have said to you, I would love to see doctors and nurses especially, can I just say, recompensed to a level that is in line with the skills and the amount of training they have to go through. I've said that. But what do you do when the money's just not there? When the economy is on its knees, as we know it is.
It's a case of redirection. And as I said, it's not just about the money. What about the training positions? Why are we being replaced? Why has the government got enough
because
money
we can't
to pay
afford you,
PAs
apparently. You
and
just said so
replace
yourself.
doctors?
You're being replaced because the UK economy can't afford to pay British doctors as much as they would like, and it's cheaper to bring in doctors from abroad. So that answers that question.
What makes me really sad is that patients at the moment want to see a doctor but get given a pharmacist appointment.
I know.
Get seen by a nurse. They don't get what they need because they've not been trained in the same way as a doctor to get a doctor's service, right? So we have to rebook them. This adds up in terms of the cost. This is where the cost inefficiencies are. And the government really thinks that by just replacing us by cheaper staff, that's going to solve the problem. This is where the wastage of the money is happening.
One thing I hear a lot from people is the idea that the people running the health service don't actually know what it's like to work for the health service, that they are bureaucrats, that they're not trained doctors and nurses, they've not been on the shop floor, let's say, and we'd be far better with an NHS staffed and managed by people who know the reality of the situation, of which you were one. So let's try and see if we can draw out a solution here. Let's say the pot of money cannot increase because the economy is really not in a good state. We all know that. You'd have to be living under a rock to think otherwise. So let's just say the budget stays as it is. Well, what is the solution then?
The solution is redirecting the funds. And that will involve cost cutting in other areas of the NHS. And absolutely, as a clinical staff member, I would always think that the priority should be clinical staff. They should be prioritized because they're delivering the service.
So what are we cutting?
There are many layers of inefficiencies when it comes to management that needs to be looked at very stringently. And unfortunately, that might result in job losses in other areas. But we have to think about, and this happened last year with the NHS England being axed as well. But we have to think about where the money is being spent and where would it be best utilized. And part of this is also about giving resident doctors in this country hope as well. And that means increasing training positions and not blurring the roles of resident doctors and these R staff, as we call them, or pharmacists, PAs, nurses, etc.
But I just want to know
in society. Stop chastising us all over media. Stop creating this media narrative. You know, using words like ransom, calling us things like all the negative terminology. This has resulted in resident doctors and NHS staff getting so much more violence from patients as well.
I'm not sure. Listen, I think that was Wes Streeting's words. Let's clarify that. And he was calling the BMA, the union, that. If anything is true, one thing I've noticed is there's a sort of mantra. The minute you want to talk about the NHS, it's sort of an understood form of words that you use, where you always have to say, our hard-working doctors and nurses. We stood on our doorsteps banging saucepans for the best part of a year. I think that by and large, when people talk about the NHS, the recognition that the frontline medical staff are vital and do an important role is always acknowledged, But we seem to go round in circles. With successive governments, we just end up in a deeper and deeper black hole. Probably, I would suggest that our NHS is entirely state-run, so it is intrinsically tied to the economy. I used to live in Belgium, where the population density of Brussels is akin to London, okay? And it's a hugely diverse city as well. And yet, their medical service works really well because it operates as a sort of hybrid between state-provided medicine and the private sector. Is it time now that we suddenly go, do you know what, governments aren't very good at running the health service? Perhaps we need a massive overhaul and a rethink right at the very bones of the NHS.
I would agree. There's lots to be learned from private services. First of all is its efficiencies, because it's all about money, and because they're smaller companies. And this is one of the reasons why GP services, as much as patients feel like they do not get what they're looking for from GPs, are run very efficiently. They don't use extra resources than they absolutely need to, because everything is tied to profit making. The unfortunate problem with the NHS, and this is my experience as a patient as well, so many layers. You know, if you're a patient, you try to find one thing out from your hospital. You have to call one person, then you have to call another person, have to call another person. Yeah. Nobody actually feels like they're doing their job. Yeah. And I feel there are lots of people employed within the NHS that are absolutely terrible at their job. They shouldn't have that job. Do you know, if you can't pick up a phone as a secretary and answer a question that a patient is asking you, you shouldn't have that job.
I'm
And we
really
should
minded
get
to
rid of
agree with
people
you.
that are bad at their job and create competition and create an opportunity. At the moment, any doctor can get the job. We should be focusing on quality. The best quality doctors should be staying in the UK, not leaving the UK and going to other countries, which is the opposite of what's happening, actually. The people who are, unfortunately, who are desperate, they have no other option but to stay in the UK, are staying in the UK in the NHS. Everybody else who's got the skill set is leaving because they have better options. So we should create competition.
Dr Bhasha, it's been wonderful talking to you. And can I just say thank you? Because I do think that the vast majority of doctors and GPs are really under duress and largely do their best to do what is an extremely difficult job. Although I do think, you know, what we've got in the NHS is basically the state with a few doctors attached to it. And the government aren't pretty good at running a lot of things, are they? So why on earth they should be running the health service, I don't know. You just have to look at countries where it does work, who are also in economic turmoil. France, you know, most of Europe is. And yet their health services just really aren't on their knees as much as ours. We've got to stop treating the NHS like this sacred cow that must be state-led. It's over-politicised, and you know what happens when anything's politicised. It's only a matter of time before it goes to the dogs.